It sucks when you have something that you've been looking forward to, something that you've wanted for quite some time, and it just ends up making your life even harder than it was before. Give you guys the example of a patient who has osteoarthritis in their right knee and was getting injections in their knee for a few months, and it was helping out, but ultimately wanted to get surgery on that knee. Patient saw an orthopedic surgeon and they approved the knee surgery. Patient has a complicated history of DVTs, which are deep vein thrombosis, and PEs, which are pulmonary emboli, and this patient is on blood thinners. For any major surgery like that, you do have to stop your blood thinner about 48 hours prior to the procedure. The surgeon wanted the patient off of blood thinners for an additional 2 days after the surgery. Apparently, this patient was in physical therapy when they started having severe chest pain radiating to the back. They were sent to the ER immediately, and they did a CT angio of the chest and found that this patient had a massive pulmonary emboli that was causing strain on the right side of the heart. Patient was admitted, started on a heparin drip. Heparin is a blood thinner. And then, unfortunately, while in the hospital, started to become altered, had slurring of their speech, and then had an MRI of the brain, which confirmed a stroke. And this is all because they were off of their blood thinner for just a few days. Now, this patient has to recover from not only just having their knee replaced, but now they have to recover from massive pulmonary embolism and a stroke. It's just very unfortunate to go for a surgery that you're probably looking forward to because you think it's going to improve your life and your health, and then it ends up turning into something like this.